I'd like to speak with you for a little bit about why we need trained craniosacral therapy longevity specialists. And I just want to share with you about the emerging need for these trained therapists and the senior healthcare system. Now, I want to really just share with you a couple of facts really quick about the aging process and trained therapists to address this. We know that we have quite a facility in training people in obstetrics and pediatrics, and the point I want to make in terms of the numbers is the same type of need is emerging in terms of understanding the needs of seniors as well. And by that, I mean anyone over 60 years in the United States. So here are some facts to be aware of very quickly. There's over 100 million people in the United States, 50 years or over, and about 70 million of those people, like myself, are baby boomers. So summed together, that's about 100 million people, or about a third of the national population. And in the next 10 to 15 years, as Bill Thomas, one of the pace setters really in senior care, quoted me some time ago, he says, this baby boomer generation, the silver tsunami, will transform all aspects of our culture as they move into what he calls elderhood, another stage of development and aging. And so for senior care in the United States and around the world, there's an increasing need with this third of the population moving forward. Now, another interesting fact is that in terms of an emerging healthcare crisis, there's about 79 million people that are pre-diabetic and about 20 to 30 million that are actually diabetic. So that's 100 million people that are diabetic or pre-diabetic. And that's pointing to the fact that a lot of the diseases of aging, that I call them, are inflammatory in nature, which our immune system classes and our lymphatic classes speak about as well. And these diseases of aging include cardiovascular disease, osteoporosis, dementia, anything with an itis after them. And those will at some point, not in all cases, but at some point not overflow into the body, but also overflow into the brain. And that's how we create and have the problems with Alzheimer's and dementia. So as an adjunct to what we're already learning in terms of treating the glial cells and in treating the immune system, my class, Craniosacral Therapy for Longevity, Applications for Prevention, also addresses this specific need of an aging population. And as I pointed out before, people with Alzheimer's just don't one day wake up with Alzheimer's like you wake up with a flu. This thing has been brewing in terms of diseases of inflammation for 10 or 20, sometimes longer, before this occurs. So the earlier that we can diagnose it and really look at the factors leading into this, the better. So one other piece of background is that it's considered by the American Alzheimer's Association that Alzheimer's is the sixth leading cause of death. That's about 84,000 people a year. However, when Rush Hospital a few years ago started to look at the actual cause of death, very often it's cardiac and respiratory distress. And that means that about 500,000 people a year are dying from Alzheimer's. That would really make it officially the third leading cause of death in the United States. So I consider that to be a fairly significant factor for us to be aware of, all of the trained craniosacral therapists around the country and around the world. When I met with author Jack Canfield, who authored Chicken Soup for the Soul and has sold about 500,000 books around the world, and he had looked at a CNN report and a special on Alzheimer's dementia. And what the special said is that, CNN said, is that basically Alzheimer's dementia at some point will bankrupt the Medicare and Medicaid system. And what's called the NHE, or the National Healthcare Expenditure, is $3.2 trillion annually currently. And Medicaid's about $643 billion. Medicare is about $540 billion. So the total is $1.1 trillion, which is about 34% of the total healthcare expenditure in the United States, just on seniors. And, as the CNN report mentioned, in the next 20 years, even the care, 24/7 care for Alzheimer's dementia will be $1.1 trillion, equal to the current Medicare and Medicaid budget. So that's how they get to that claim. So that's significant in terms of the problem we're addressing. So here's an opportunity for us to reach the tipping point in healthcare. And this is coming. We don't know exactly when, but this is coming. So what do I mean by the tipping point? It's the junction between pharmaceutical intervention, and there's no known cure for Alzheimer's, and insurance costs, and increased healthcare expenditure, and alternative treatment. Because, as any politician will tell you, people generally don't like to increase taxes, or it's also unpopular to reduce expenditures because a lot of people will be left uncovered. However, there's another option, and that's called prevention. That's where the tipping point is. People are beginning to realize that it might be cheaper to actually reimburse for prevention than it is to cover acute cost. So what also is driving this is the children of people with Alzheimer's who want a better quality of life for their parents. They would like a reduction of cost, and they would like to learn techniques for self-care. So what I have done with craniosacral therapy is looked at the science around the lymphatic system and craniosacral therapy and realized that as people from University of Rochester and others are researching, that research on the lymphatic system shows that there's a drainage system in the brain that's even more efficient than anyone thought, which explains why we've gotten such great results with closed-end injury, Alzheimer's, concussions, and so on and so forth. So what I'm doing is adding craniosacral therapy, 2 changes in diet, and exercise to say there's a simple technique that could be even practiced 5 to 10 minutes a day. That is the still point that we all know about. And I'm training therapists to also apply advanced techniques that we've learned with work on the immune system and in the glial system and others to say we can actually have more specialized therapists really address this increasing need. And I'm really looking at social media and looking at other avenues to say this is what we can do to change this. And what we're doing is actually getting more and more people around the country asking for qualified longevity specialists in each area, whether they're in Minneapolis or Palm Beach or Los Angeles or in Ireland or in Italy, where I just taught, anywhere in the world. And they're looking for specialized trained therapists to do that. So we have a growing need. And Jack Canfield, among others, feel that this is a very, very important thing that we're doing. And he says 3 things in his evaluation of what I'm doing. He's saying that A, this is an easily learned technique. He's had it done in himself. B, that it's affordable. And C, it's scalable. That with all of the therapists we have in the United States and the world, if they have this additional training in longevity, we can actually address a burgeoning population and keep them safe and help them in terms of preventing this disease. So take a look at preventingalzheimers.com, my website, and also my Facebook page, Preventing Alzheimer's and Body Energy Company. Also, I'd like to invite you, all of you in the U.S., to take a look at my craniosacral therapy for longevity, reversal of the aging process class that's being held July 20th and 23rd in Palm Beach at the Upledger Institute, and then about a month later in Toronto in Canada. And I'm beginning to teach these classes at various places around the world. But I really want to encourage you to look at a rising need because we want to be able to refer all of you to the seniors that really, really need this help. And we think this can make a big difference now and in the next 20 years in the quality of our life. Thank you so much for being dedicated to what you do, and really look to talking again with all of you soon. Thank you.